Extra minutes.
Every now and then in this job, you come across an act of bastardry so shocking it takes your breath away. Usually it involves conmen or thieves. In this case, it involves the Canberra Hospital and its so-called Ethics Committee. You see, a couple of years ago, a young woman named Lauren Kish finally convinced the hospital to allow her to undergo stem cell treatment for her multiple sclerosis. They'd already made her wait 2 years, 2 years in which her disease worsened. So Lauren was pretty excited when the treatment began. The hospital harvested her stem cells and began chemotherapy. Lauren's hair began to fall out, but she didn't mind because this is a treatment that can stop the disease in its tracks. In fact, the most recent studies show it has a 92% success rate for patients her age. But one day, in July 2012, Lauren was summoned to a meeting where she was told her treatment would be stopped immediately. Not only that, if she wanted her stem cells reinfused, she'd have to find someone else to put them back in.
That was when he said to us, "I'm sorry, but we're not taking you any further. It's the end of the line." And I said, "But you've got my stem cells." And I said, "Well, what am I supposed to do now?" And he said, "We'll find another hospital to put them back in." We were like, "What? How could this be happening?"
What were you told about why they were stopping the treatment midway through?
We weren't given any particular reason except that the Ethics Committee had said no.
There was no explanation, no right of appeal. All Lauren was told was that the hospital's Ethics Committee had ordered her treatment stopped. The hospital refused even to tell Lauren's own neurologist why.
It's absolutely terrible that someone can be harvested and then left high and dry without any further treatment or conclusion to the procedure. Really, that was something awful. I can't imagine a doctor doing that.
We've spent the last few weeks asking for an interview with this Ethics Committee without success. Lauren Kish bravely waived all her rights to privacy so the committee could have no excuse for refusing to answer our questions. But that's just what it's done. Little wonder hundreds, perhaps thousands of Australians are forced overseas to get life-saving treatment. Canberra Hospital may think it's entitled to refuse such life-saving treatment, but it's not entitled to treat its patients with such utter contempt.